So I'm going to be talking about my Indian experience here, treating darker skin types for acne scars. I've been treating since 18 years and it has been a journey. These are my disclosures. So why are we talking about darker skin types, as Dr. Sar rightly mentioned? And we have this tendency of hyperpigmentation. Whatever we do, whenever we go and introduce a device on the skin, immediately there's a potential of post-inflammatory hyperpigmentation, which takes months to resolve. And that's why we have to find solutions which will help to reduce the duration of PIH and the incidence while treating the acne scar. That's most essential for us in my Indian patients. Whenever we are treating Indian skin types, we are very conservative, we are cautious, and that's why we're talking about it today. So we all know about acne scars. There are macular, there's elevated scars and depressed atrophic scars. We have published a chapter in the book on this. How do I treat acne scars in individuals with darker skin tones? So this is a quick algorithm on what I do for my acne scars. For macular scars, we use mostly peels and 1064 Q-switch laser. Atrophic scars, again, we use a lot of CO2, erbium YAG. We use also microneedling radiofrequency, and then obviously there's tissue augmentation and PRP as supportive for these scars. And hypertrophic, obviously, we have intralesional and silicone. So whenever you're looking at acne scars, it's always a combination, a multimodal approach, because what happens is in an individual, there would coexist varying scars, right from macular to atrophic to hypertrophic. So that's the reason a combination is essential. So a quick overview on how I use the various technologies. So in chemical peels, I generally use combination peels. I don't use a solo peel. So we have various ingredients in liposomal formats like glycolic, salicylic, arbutin. It helps with the exfoliation of epidermis and dermis and improves the texture and color. So this is a quick way how we do it. It is non-invasive. Patients love it. We apply the leave-on peels. These are liposomal peels where you apply it, and it's a slow release peels in the skin. So it's great for darker skin tones. We don't have the potential of PIH, and we see good results within a month of, we do the sessions every 15 days apart, around 2 to 3 sessions. We see these are some of the results of our chemical peels. We had a bride who was getting married and this acne was there. Even in a single session, we could see a good resolution of acne with the scarring, along with topical antibiotics and products. This is again a result of chemical peel post-inflammatory hyperpigmentation. She was concerned. Fairness is a major concern or need in Indian skin types, and that's why there's a lot of focus on lightening the skin tone. Then coming to 1064 nanometers Q-switch, this is a paper we published in 2015 where we reviewed 78 patients of ours. We treated them with 1064 Q-switch, and what we found is 70% of the patients were happy. Obviously, when we are looking at 1064 nanometers, as my speakers previously spoke about it, we use low pulses, low fluences, multiple passes. This is a carbon peel which was done wherein, it helps in reducing the seborrhea as well as the pigmentation. We see results in 2 months of the session, and we have to be careful about photosensitivity in these patients. So this is again results of 1064 nanometer Q-switch. As you can see, there's a good resolution of the PIH scars. Overall, the tone and the color also improves, and obviously we combine it with supportive treatments and topical products. Then coming to fractional lasers, I use 2 technologies, mainly fractional CO2 laser. Again, it was a challenge for us because we have Indian skin type and the potential of scarring and hyperpigmentation is there. So I'm using an Indian company, Energy, which is made in India, and I really find the results are very good because safety is very high. And then we have fractionated erbium YAG laser. I use more of CO2, as you can see. This is a CO2 device I'm using after topical and anesthetic. We do density and parameter energy play so that we get good results. There is a downtime. We super align our patients that for 10 days you're not stepping out in the sun, and obviously we match it up with good sunscreen and barrier repair creams. So this is how we do the lasers. So these are some of the results. There is a little light difference, but patient was very happy. As you can see, most of our scars have resolved. This is another gentleman whom we have done microneedling radiofrequency, didn't give that much results, and that's where we use the Energy device with great results in him. Energy-based treatment, we all know about microneedling radiofrequency. I'm also doing a lot of substitutional radiofrequency nowadays. Microneedling radiofrequency is a go-to for our Indian patients because it doesn't have a downtime, it's colorblind, there is no chance of hyperpigmentation. If we are very careful, we can get great results, and we do combine with other technologies. So these are some of the results of microneedling radiofrequency. And this is the subsessional radiofrequency, where we found that certain patients with rolling scars are very resistant to other treatment modalities, and we can't do multiple punch biopsies in atrophic scars which are extensive. This is where the subsessional radiofrequency helps, because subsession is very superficial and it doesn't help with collagen remodeling. When you combine subsessional radiofrequency, what happens is there's superficial clearing with the subsessional, and radiofrequency goes and generates collagen. So we see a good improvement in the scars. It is a minimal invasive procedure, so you have to, we tell our patients about it. There will be a little bit of edema, otherwise there's no visible downtime. Patients are pretty comfortable. We infiltrate and then we go in and do multiple passes, both epidermal and dermal, and thereby help with reducing the scars which are holding the skin down. So this is a very great option for your rolling scars which are not responsive. Even in one session, we see good results in our patients. So good clarity, and here again the potential of PIH is less because it's more an internal procedure. We are not abrading the epidermis in this. And lastly, we also combined a lot of tissue augmentation. Nowadays, we do dermal fillers always were there, but we started using a lot of nanofat, which is easy to do. We do the procedure of microneedling radiofrequency or subsessional radiofrequency or a CO2, and then inject the nanofat all over the face. It gives a great rejuvenation. It is having a downtime of 7-10 days, but this combination helps to again bring down the pH, and our patients really do not come back with a lot of post-inflammatory hyperpigmentation. So even in single session, we see a good clarity and reduction in scars and tone of skin. And I do a lot of PRP to again avoid post-inflammatory hyperpigmentation. Growth factor concentrated is a derivative of PRP. This helps to, I think, bring down the pigment, and thereby patients are more happy and they see a good color change when we are using these modalities as supportive when we are doing our lasers and other devices. So again, this is a combination where I've combined the microneedling radiofrequency with the growth factor concentrate out here, as you can see. So it's important when you're doing darker skin types, certain scars are not very responsive to treatments. You need really 4 to 6 months before we can tell a patient. And generally, I don't do patchwork. I do a whole face treatment followed by more focus on the concern areas of the scars. It's very important you're judicious with your energy and density levels. Stick to recommended protocols. What I suggest for my Indian patients is lesser passes, short pulse duration, low density, and longer wavelength. Especially in resurfacing lasers, when you're doing superficial scars, increase the density and reduce the energy levels to reduce the pH. And for deeper scars, decrease the density and increase the energy levels. So this is how we treat. This, I wanted to highlight, this is a very common problem in India, steroid-induced, atrophy and scar and acne. People are crazy about fairness. They take the neighborhood creams. This is a steroid-induced problem which we got with a lot of acne, and it took us nearly 8 to 9 months to resolve. So thank you so much for having me.